Membership, Miss Carly Cersei.
Great. Thank you, Verna. Thank you so much. As Verna said, I'm Carly Cersei. I'm Associate Director for Programming and Membership at ICUDDR, and I've been with ICUDDR for 3 years now. In that time, it's been my pleasure to serve our members and support our universities. And as Verna said, you're joining us today at an exciting time for our organization, and I'll share why I think this is the perfect time to share information with you and have a conversation about the work we do on behalf of our members. ICUDDR is a nonprofit organization, and our funding has primarily come from a 5-year grant from the Bureau of International Narcotics and Law Enforcement Affairs, which is part of the U.S. State Department. Those first 5 years recently concluded. We also have some additional funding from NIDA and other organizations. It is much smaller by comparison. So ICUDDR applied for another 5-year grant with INL to continue our work, and we were recently awarded that grant. We also applied for a grant to lead the credentialing work of GCCC, the Global Center for Credentialing and Certification, and we were awarded that as well. And that means we've increased our scope of work considerably in ways that I am certain will allow us to serve our members in improved and more efficient ways. And within ICUDDR, we now have 4 centers. Those are the Center for Programming and Membership, the Center for Research and Development, and at this time I lead both of those first 2 centers. Also, the Center for Credentialing and Certification, which is led by Dr. Carmel Clancy. And finally, the Center for Systems Change. And we have one program in that center, the International Technology Transfer Center, or ITTC Network for Drug Demand Reduction. Dr. Lori Crom is Director of the National Coordinating Office and the ITTC Network program, and Susan Garrett is the Associate Director. So we're now a global consortium of institutes of higher education, and we're linking science, policy, education, and service to address substance use challenges and strengthen communities. And we want to use those linkages to improve the work that we do together. So my role today is primarily to listen to what is shared in the discussion portion of the event so that we can use that to inform our work now and in the future. So you'll see me taking lots of notes today. And I want to thank all of you for being here. Very excited about the information that's going to be presented and then our conversation. So at this time, I'd like to introduce today's speaker, my colleague, Sungjoo Park. Sungjoo Park is a project officer for ICUDDR's Center for Credentialing and Certification, which you may know as GCCC. Sungjoo served as an intern for ICUDDR in the summer of 2024 and recently joined our organization full-time in August. He has a master's degree in public health with a concentration in global health from George Mason University. Sungjoo also has a dual Bachelor of Science in Public Health and Human Development from Virginia Tech. Prior to his current role, he had clinical experience in a pediatric primary care setting as a medical assistant. Sungjoo currently lives in Northern Virginia, about 20 minutes from Washington, D.C. in the United States. Sungjoo, we're so glad you're here today. The floor is yours.
Carly, thank you so much for the introduction. And thank you all for being here. I think the most important part or aspect of this presentation is to hear from you guys who have come, to hear from you directly. So please be prepared to answer some questions. As Carly mentioned, just a quick, short introduction about myself. I do live in Virginia, and I have been raised here, and I've lived here for almost all my life. So not too far from Washington, D.C. So if anyone is in the area, just let me know and I'll send you some recommendations for places to see and eat and places to have fun. But anyways, this presentation is titled ICUDDR's Members Request. It's a data analysis report and discussion. And during my practicum and internship with ICUDDR this past summer, this presentation is a continuation of that project that I worked on this past summer. And so I'm presenting it all to you, and we're going to explore the findings together. So moving on with the presentation itself, just a quick introduction and background about this presentation. So ICUDDR, we have been collecting data from the new member registrants. So whenever you sign up on our website, as Carly encouraged earlier. Please make sure to do that if you haven't done so already. But if you sign up on our website where you are asked this question, please indicate how ICUDDR can help assist you. So this data was collected from January of 2022 to May of 2024, which is when I conducted the data analysis. And the purpose of this analysis was to report on the findings of this question that's found in our website. So a quick overview of the data as of 2024. The total number of members we have is 676. And the total number of responses we received was 154, which gives us a response rate of almost 23%. So a little bit into the methods of this data analysis. When you register on our website, you're able to decide or choose the level of membership. So if your university as a whole, as a collective, wants to sign up for membership, you can select that option. However, if you are a faculty member and you want to sign up as an individual, you can do that as well. So the registrants were filtered by those levels, so university level and individual level. And then they were filtered down by responses and no responses. And obviously the no responses were excluded from this analysis. The responses were then stratified by region, country, and date of submission, respectively. So then I went through all of the responses and I found some 5 major themes, which I coded them under. So the 5 themes are the following. Theme 1 is training. Theme 2 is research. Theme 3 is networking. Theme 4 is information. And theme 5 is general resources. Each response, as I went through them, was coded under each theme only once. So I'll go over that in a little bit. But each theme was coded in binary. So it either was 1 or 0. So it either counted as a response under that theme or it didn't. So under these themes, these were the following terms that were categorized under each theme. So just to go over one of them, a few of them, networking was kind of our biggest one. So under networking, if any of the responses included these terms, such as exposure, international, global, opportunities, collaboration, connection, recognition, interaction, those would all fall under the networking theme. Same thing for information. If it included education, webinars, teaching, learning strategies, those would all fall under information. So I'll leave this up for a little bit just for everyone to take a look at. So moving on. This is a quick example of how the responses were coded. So here's an example from the Asia Pacific region from Pakistan. This individual requested that we assist him or her with collaboration, training, webinar, and policy designing. So as you can see on the right-hand side, they mentioned training. So I coded that. Mentioned networking, collaboration. So I coded that as well. And then general resources, which is policy designing, so on and so forth. Another example on the bottom is from the Middle East, from Jordan. They said, effective academic programs in addiction studies and 2 research support. So obviously, I coded it by research and information. And so what I mean by each one was coded only once, for example, if this first response here were to mention collaboration and conferences, that would only count as one response under networking, just to make sure that everything is evenly distributed and represented. So a quick overview of how each region was represented. Here's a little bar graph here. So from our Africa region, we had about 24.6% response. From our Asia Pacific, we had the most responses here. We had 45.5% of the responses were from the Asia Pacific region. 6.49% were from the Europe region. 14.29% were from the Latin America and Caribbean region. 3.9% was from the Middle East, and 5.19% was from the US and Canada. And overall, we had 154 responses, as I mentioned earlier. So I'll give you an overall view of the results that I found, and then I'll break them down by each region. And so on the individual level, what I found overall was that the number one ask from ICUDDR, from our members, was networking. Then the second one was information. Third was training. Fourth was research. And fifth was general resources, in that order. And then we can see a similar thing, the same thing over here on the right side from the university level. The number one ask was networking, 2 was information, 3 was training, 4 was research, and 5 were general resources. And I'll leave this up again for a little bit for everyone to take a look at. So breaking it down by each respective region, I started with the Africa region first. And so these are the individual countries that were represented within those responses. So as we can see, Kenya had 15, Nigeria had 12, Botswana had 3, and so on and so forth. And from the Africa region, we had 38 responses total. So from the Africa region, their asks from us, their requests from us, on the individual level was networking and research with a tie of 26.1%. Then it was training, then information, and then general resources. On the university level, which we had 10 responses, the universities asked from us networking, training, information, general resources, and research. And here's some qualitative examples of the responses that we received from this region. So just to read one of them, from Nigeria, this particular individual is a faculty for behavioral studies in their university. And they said, to gain expertise through training in drug demand reduction, also have global connections through participation in workshops organized by ICUDDR. Finally, to be properly equipped with evidence-based tools to train members of my university's community on drug demand reduction. And here are some more examples at the bottom. So moving on to the Asia Pacific region, we had a total of 70 responses from this region. As you can see, we had exponentially, Pakistan had an exponential number of responses with 45. And then 5 with Sri Lanka, 4 with Indonesia, 4 with the Philippines, and so on and so forth. So on the individual level, from the Asia Pacific region, which had a total of 52 responses, the Asia Pacific region asked from us was information, networking, training, research, and general resources. On the university level, which we had 18 responses, their requests were 1, networking, 2, information, 3, training, 4, general resources, and 5, oh, I'm sorry, this is supposed to say 5, research. And under Asia Pacific, some qualitative examples. Here's one from Sri Lanka, under the Department of Philosophy. They mentioned, I would expecting to expand my visibility and recognition within the field of drug demand reduction. This recognition can be valuable for individuals and institutions seeking to contribute to the advancement of the field. And here are some other examples. And moving on to the Europe region, we had a total of 10 responses, and 5 of them were from the UK of Great Britain and Northern Ireland. We had 2 from Croatia, 2 from Greece, which we just visited this past summer, and 1 from Czechia. So for the Europe region, on the individual level, we had 5 responses, and their top 3 asks were: number 1, information and research were tied. Number 2, networking and general resources were tied. And then the last one was training. On the university level, again, 5 responses. Number 1, networking and information were tied. 2 was research. 3 was training, and 4 were general resources. And again, more qualitative examples from the Europe region. So here is one from Greece. Research on early detection, prevention and treatment, and harm reduction, exchange of knowledge, update current controversial topics, and create a network for ongoing information sharing and cross-fertilization of knowledge. And then again, some other examples. Then for the Latin America and the Caribbean region, we had a total of 22 responses, 7 from Mexico, 6 from Argentina, 4 from Brazil, 2 from Chile, 2 from Ecuador, and 1 from Colombia. And again, on the individual level for this region, we had a total of 11 responses, and their number 1 ask was networking. Then for second, training, information, and general resources were all tied. And number 3 was research. On the university level, again, 11 responses. We had number 1 being networking and information. The second request was training, research, and general resources all tied. And again, here are some more qualitative examples from the Latin American, the Caribbean region. So here's one from Brazil. We had this particular individual mentioned information and training on how to address addictive behaviors, particularly technology and gaming addiction, discussions and information about scientific methodologies, writing scientific articles, assessment tools, addiction prevention strategies. And then here's some responses from Mexico and Chile as well. Then for the Middle East region, we had total of 6 responses, 2 from Israel, 2 from Jordan, 1 from Afghanistan, and 1 from Lebanon. And on the individual level, we had 4 responses, and from these responses, the top 3 requests were: number 1, researching; number 2, networking, information, and general resources; and then number 3 was training. Same thing over on the university level as well. We had 2 responses, and their top 3 asks were the same. Then some examples from the Middle East region. So here is one from Jordan. This is the one I mentioned in my presentation earlier, but their 2 requests from us were: 1, effective academic programs in addiction studies, and 2, research support. And then last but not least, we have the US and Canada region. And we had a total of 8 responses from this region, seven of them being from the US and 1 of them being from Canada. So again, on the individual level, 7 responses. We had the top 4 asks being networking, training, information and general resources, and then research. On the university level, which was one member, we had research, networking, and information tied for the number 1 ask, and 2 being training and general resources. And then again, some qualitative examples from the US and Canada. So one from the US, they mentioned, we want to get involved with ICUDDR's network of universities worldwide, particularly in academic and all programs in addiction studies. So before I go into the conclusions, I wanted to mention some limitations of this data analysis. So number 1 was inter-rater reliability limitations due to limited staff availability. And so because we couldn't devote so much time, everyone's time for this data analysis, I worked on this as an individual. So again, some of these could have been subjective, which is the second limitation. The interpretation would be subjective according to what I had defined under each theme. And so maybe if we were to run this again with different people, perhaps we would have different results or the same results, or results that aren't too far off from what I originally found. But again, as Carly had mentioned, we were going through some growth. And so although we had this limitation, I think it's the trajectory that we're on is that we're growing and we're better able to understand these things and address them as well. The last one is some missing data. So regarding the question, please indicate how ICUDDR can assist you. This data wasn't being collected until 2022 for reasons that we don't know before most of us started working for ICUDDR. So prior to 2022, we don't have that data accessible to us. So, which is why I mentioned earlier in the introduction, we only have data from January of 2022 all the way up until now. So data before, maybe that would have skewed or changed the results a little bit. We're not sure. So going into the conclusion, across both the university and individual level, the members' requests from each region were pretty similar. So from Africa, networking and training; from Asia Pacific, networking and information; Europe was networking and information; Latin America and the Caribbean was networking and information; Middle East was research and networking; and the US and Canada was networking and training. And so the overall top 2 asks that we had found from this data analysis, as I mentioned in the overall results earlier, was number 1 being networking. So this is more conferences, recognition, collaboration, connection with other universities. And number 2 was information, which is strategies, education, webinars and seminars like we're having right now. And so those were the top 2 asks that we found that we now know to strengthen and to address more if we haven't been doing that already. And I think this is interesting because the top 2 asks that we have from our members, either our members understand our niche in the field and the services that we provide, or this is what they would like to see more of. And so I think this is helpful information to us as an organization to know what we do and know what we know what we already do well and know what we should do better. So that actually leads into the discussion portion of this presentation. We have a number of questions here. I'll read them out really quick. Number 1, please share any requests you might have as a member. Excuse me. What can ICUDDR do more or less of in order to adjust these requests? Which services could ICUDDR improve? And any other questions or requests that you would like to bring up. And so we can go through the chat box, or if you'd like to unmute, you can do that as well, so that we can hear from you directly. So now is the time to do so. And I believe, Carly, you'll be going through those requests. I'm sorry, the answers.
Absolutely. As I said, my hope is to do a lot of listening and not as much talking, in listening to what folks have to say after hearing what you shared. And so, please feel free to unmute your mics or to type in the chat. If you're not able to do that, you're welcome to turn on cameras, if you would like to and are able to do that as well. While we're waiting for folks to think about that, Sungjoo, just one of the things that I noted is that this work of information and networking, or as I was thinking about it, disseminating and connecting, that is really core to the work that we've been doing. So it's exciting to hear that. I also think it's an area that's really easy to undervalue. So I appreciate our members lifting that up and your work in sifting that out from all of those different responses. And I think the charge for us, one of our charges, is to think creatively about how we're going to measure those things, because we know they're important. We know that we're doing them. We have some ideas for doing them in different ways going forward, but we're going to be thinking, and you certainly as part of the evaluation team, about how we can measure those things as well. Anyone else on the call have some things that they'd like to share?
And you can answer any of these questions in any order. It doesn't have to be all of them. It could be one of them. Just let us know which one you're referring to.
Good. I salute you and thank you, Park. I am Rabbi from Ghana. I don't know whether you can hear me well.
Yes, we can hear you.
Good. I am in one of the universities in Ghana, precisely Kwame Nkrumah University of Science and Technology. I am a member since I think 2 years, but I'm thinking of trying to push the whole university to be a member of ICUDDR. Sorry, I am deviating from your question, but I'll be much grateful if you can give me more information as to how I can help the university register with ICUDDR. I'm a psychologist with a counseling center, and our main task is to provide mental health support for staff and students. We are part of ISOP. We are yet to rule ISOP in Ghana, but with ICUDDR, we do not have it in Ghana at all. So I am thinking of pushing the university to, join ICUDDR. So I'll be grateful if you can give me more information as to how we can be part. I'm grateful. Thank you.
Thank you so much for speaking up about that, Rabbi Darko, and we would be thrilled to have your university consider membership. And typically this is how membership starts. There is one faculty member who's really interested and brings that to the leadership of the university for a conversation. We are happy to assist you in that conversation. Once you have approval from the university, the process of application is fairly simple because we do not want to create barriers to joining ICUDDR. In fact, we think of this initial joining as kind of opening the door to all of the things that we can do together, whether that is conferences, whether that is giving you access to curricula, whether that is connecting you to our regions so you can be a part of the exciting regional work that's happening. Lots of different ways to connect as an individual member, and then some special opportunities as a university member. So I will put my email address in the chat. And Rabbi Darko, if you would reach out to me after today's call, we could do a little back and forth, just making sure that you have the support that you need to have a conversation at your university, be about joining as an institution. And thank you for that interest. Really appreciate it.
Thank you for your submission. Thank you. I'm grateful.
Any other questions we can answer or things we can discuss while we have all of you on the call today?
Yes, hello, am I audible? Carly,
Yes.
this is Fayaz Ahmed from Pakistan, and currently I'm working with A University Islamabad, and I'm lecturer there. Also working with substance use and conducting my PhD research in the treatment of substance use disorder. Recently, it was a very pleasant moment for us that you people have launched a training on the data analysis, particularly that was on the series of the R. So that was too good, and I feel that such trainings, actually build skills in the researchers, and these are very important for the researchers. So I'm just requesting and asking one question: that is there any, further trainings which are like, for example, based on some other softwares as SPSS, M+, MOS, for the qualitative research and Vivo? Do you people have any such sort of planning for this, or what it is? Number one. Number two. So as you know, I'm conducting my PhD research in the treatment of addiction treatment. So is there any opportunity for the PhD scholars to conduct the researches which are sponsored by your institution? You people are referring the member of the ICUDDR to any particular university from where they could actually conduct the research?
Very good. Two great questions. The first I will say is yes, we do have additional webinars planned that are similar to our workshop and the data analysis work. That's something that we heard from our members that they appreciated about our workshop, and we've heard is a real need. So thank you for asking that question. And when I finish, I'll invite my colleague Verna to share a little bit more. She's been working on planning that. In terms of your research, we do have some funding with our new grants, and it sits in sort of three places. One is related to fellowship type training, and more information about all of these will be coming. But a couple of things that will launch sooner. One will be the opportunity to do some regional funding of projects that probably is not specific to your PhD, unless your work as a PhD student is connected to the regional work. There will also be some funded projects for our ITTCs as well. So those are the areas of funding that we have access to with our current grants. We're always seeking more support. And another thing that I would like to do that I think will be very valuable to PhD students in this next year, as we change our website, we're getting ready for a big website change. We know that we want it to be multi-directional. So not just one way where we're sharing with you the things that we're doing at ICUDDR resources, but that you can share back as well with your fellow members, participate in forums. I could certainly see having a nice research forum for people to connect that way. We understand that sometimes for international researchers, a good opportunity for funding is connecting with a US-based researcher, and that's the kind of relationship we might be able to help facilitate. So please watch for that. And also in our resources, one of the things I would like to change is, after listening to our members and hearing the things that would be truly valuable to members, this is one of those things, right? Knowing what fellowship and research funding opportunities are out there. So that is something that we'll be working on together as well. And again, I will put my email address in the chat in case you'd like to reach out individually and just talk about what you're working on, and I can get you connected hopefully to our regional work, or perhaps you already are, because Pakistan is a very engaged country in terms of work with ICUDDR, and we really appreciate all the efforts that are happening there. So thank you for both of those questions. Verna, would you like to share a little bit about 2024-2025 events related to data analysis?
Okay,
Right.
thank you. I was about to put it in the chat box. So good morning again. So for next year, we are actually planning more research-related webinars, including one in qualitative research. We're also planning to do one on path analysis and structural equation modeling. And more than that, we actually wanted to provide more software-based workshops. But mostly one of the challenges is that we want to make sure that the software is accessible to our members. So therefore, we select the open source software. But please watch out for that. And if you are not in our mailing list, please be included. And we'll make the announcements as soon as we can. And if you can join, there will be some regional conferences of ICUDDR. We plan to bring these workshops in person to be able to make most out of our members. Thank you.
Thank you,
Okay,
Verna.
thank you. Thank you very much, Colin.
Thank you. Those were excellent questions, and I appreciate you speaking up and giving us the chance to share a little bit more information. Anyone else on the call have a question, want to talk about services, what we're focusing on, or other requests you might have as a member? Thank you for sharing, Dr. Singh or Mr. Singh or Ms. Singh. Lots of emerging cases of alcohol with benzodiazepine dependency in India. Thank you for sharing kind of what you're seeing in your area. Last year we did some regional listening sessions and learned a great deal about the variety of different substances that folks are working with in different countries and in different parts of the world. And thank you, Verna. Verna put in the chat, watch out for next year's research-related webinars on those topics she talked about, qualitative research, path analysis, and structural equation modeling. And so we'll continue to work on those statistics-related workshops, and we're just so pleased that they're of value to you. All right, well, I
Again,
think,
this is Rabbi.
yes, Rabbi.
Yes, just to draw your attention, yes, in Ghana, we are discovering a lot of, let me put it, diverse drugs students and people, the youth are abusing, and some of these drugs are quite weird to us. I don't know whether you've heard of super glue, or probably I don't know how to put it. They are weird drugs that are emerging, that are coming up, that are not within the main stream of drugs we know. So I will be so happy if you can also shift your attention to Ghana, because there are a lot of substances students and the youth are abusing, which some of us, it is really alarming to us. Some of the things, when we tell you, you'll be surprised. So maybe we will talk more through meals, but I'll be happy if you can also shift your attention to some African countries, because it's becoming worse, even though we are trying to do our best to mitigate the situation, but it appears it's becoming overwhelming. So we will need your support as well. Thank you.
Thank you for sharing that, Rabbi Darko. And I have heard at a few universities more requests for how to help students with substances. So not necessarily how to teach students within the curricula, but also within your health centers. What are resources that could be provided for various substances? So thank you for lifting that up. That's been pretty recent, within the last year, that we've started to hear that. And it's an important note that I wrote down. Yes, when we did our global synthetics listening sessions, we heard about substances that, are very unique, sometimes chemically aren't sure what's in them, things like pink cocaine, but very much dependent, not just within regions, but by country, what those different substances are. And I know that's a big body of work that INL is working on. And I will ask my colleague, Verna, could you take a look and grab the Global Synthetics URL just to share that in the chat for folks who might be interested in learning more on that topic as well. So yes, thank you for the discussion in the chat as well. Verna's working on that for us now to share that.
Carly, there's a question if there's been any work done in the space regarding peer services and non-clinical delivery.
Great question. We did a webinar on peer support specialists, and that was some time ago. That was really part of a session on lived experience. And so for Tanya, if that's an interest, I saw you ask someone to drop their email address in the chat. If you'd like to leave yours for me, I can follow up after today's call and just gather some more information about what you're looking for. Or if you're able to unmute your mic and share more, that's great as well. I just don't want to make assumptions about what it is that you're looking for. So I'll watch the chat for your email address, Tanya. Very good. And thank you, Verna, for speaking to the difference between drugs and medicines in the chat as well. Well, I think we might be ready to wrap up, but this is not the end of our conversation together. As Verna said, we have a couple of more webinars scheduled where we intend to listen to members to hear what it is that you're needing. And I have shared my email address in the chat a few times, and hopefully some of you will reach out offline so we can talk a little bit more about what your needs are and we can better understand that. I do want to thank Sungjoo for sharing his work. This has been really helpful. It's the second time I've heard it, and I feel that I can continue to listen and look at it and pick out more to help us as we move forward together. Thank you, Tanya Harris, for that email address. I've copied it. And then just check in with Verna to see if there's anything else we should cover before we wrap up today.
Yes, Carly, thank you. And once again, thank you everyone for attending and for your feedback. We value that very much. Please watch out for November. We're going to talk about updates on the global credentialing system. So that's an important aspect of the expansion of ICUDDR. We'll let you know of the exact dates via email. And if you haven't followed our social media, please add us into your Facebook. There's also a Twitter. And we'll hope to see you next meeting. Thank you again.
Thank you. Thank you,
Okay.
Verna. Thank you, Sungjoo.
Thank you, everyone.
Carly, I'll get back to you.
Thank you.
Okay.
And make sure to sign up for membership if you haven't already. And make sure to respond to that question so we can continue to hear from you.
Right. Okay. Thank you so much.
Thank you,
Stay
everyone.
blessed.